the show where we share the stories of the many who intersect with our healthcare system but are rarely heard from. My name is Kevin Pho, founder and editor of KevinMD. Today in the show, we have Maryna Mammoliti. She is a psychiatrist in Canada, and she wrote the KevinMD article, Why Boundaries Should Be Part of Your 2020 Physician Goals. Maryna, welcome to the show.
Hi, Kevin. Thank you so much for having me today. I'm very excited to be here. I've actually listened to your podcast and, read your articles since 2016. Some of your original articles are in my private office. They're part of the Well Declaration. So I'm super excited to be here today. My name is Maryna Mammoliti. I'm a practicing psychiatrist in Canada. I practice in Ontario, and I also have my professional coaching practice as well. And I have 4 kids. So that's kind of my credentials. In my psychiatric practice, I work with physicians mostly and healthcare providers. I focus on ADHD, eating disorders, and trauma. And in my coaching practice, I coach on career changes, leadership boundaries, and emotional intelligence. I also love teaching medical students and residents. So I see them in my community practice and at the hospital where I work at KevinMD downtown Toronto. And I do ER psychiatry at KevinMD in Toronto. I think you know Toronto, so you'll know KevinMD where it is downtown. And I just finished my 2-year term as the psychiatry section chair for Ontario Medical Association. And I am finishing up our book on saving lives without destroying yours, Boundaries for Modern Physician. That has been my pandemic baby with my colleague, Adam Lee. So that's a little bit about me.
So you mentioned that in your psychiatry practice, you see a lot of healthcare professionals. Now, what are some common issues that you typically see that bring them in to see you?
Well, I guess it varies. Originally, when I started off, I would get referrals from the physician health program, but I also have a lot of referrals by word of mouth and also because from other hospitals and usually chiefs of staff and whatnot. Sometimes the disciplinary issues bring the physician in, sometimes it's addiction. Ideally, people seek out help when they're struggling without having other costs, attached to that, such as disciplinary issues or, significant deterioration in their function. So it really depends. Luckily, I've seen a change in physicians seeking help a lot earlier than I used to when I started practicing, where, people would be really sick when I started practicing when they come to see me. And nowadays I see people, seeking psychiatric help a lot earlier. So it's very rewarding to see because they're in a different stage. There's a lot more we could do in an outpatient practice without, having to involve inpatient care and whatnot. And so a lot of people have been presenting with burnout, depression, trauma, a lot of trauma, and definitely a lot of new onset diagnosis for ADHD that's always been there but never diagnosed. But definitely I see a lot of trauma in the context of pandemic and impact of the pandemic on the healthcare providers, particularly physicians.
So specifically as it relates to the pandemic, how much of an increase are you seeing, and what's specific about the pandemic is leading healthcare professionals to see you?
Ooh, how much have I seen? I've seen a huge uptake in physicians seeking help for mental health. Pretty much most of my week is booked with physicians from across Ontario. And what usually leads for people to seek help is, to be honest, a lot of the times lack of boundaries between their work demand, the patient's demand, the patient amount, as well as, betrayal potentially by their employer or the hospital or the system, especially at the beginning of the pandemic. That was a big issue here in Canada when we did not have enough PPE and there was a lot of inconsistency in some approach. So there was a lot of betrayal, a lot of anxiety around the virus safety. Potentially, at one point, our medical association sent out lawyers if you wanted to make a will, which was quite scary for many physicians. Here you have a medical association sending out information for lawyers to make your will. There was a lot of fear that they're going to die and not come home to their family, their children. How do you deal with your children? I have 4 of my own. It was a big issue about, are we going to survive this? Are we going to die? Any deaths of any physicians from COVID was very triggering for a lot of people, as well as the impact of our patients dying, right? And how to grieve and process the loss when you can't do anything and when you don't know what you're dealing with. So that was a big issue at the beginning of the pandemic. And now it's more about the anxiety, the lingering effect, the depressive states, as well as how to manage with the public and society when there's so much hate towards healthcare providers at this point. And as you know, in Canada right now, it's very difficult. They declared state of emergency today in Ontario because of the trucker convoys. So it's been very difficult and again, very violating for a lot of healthcare providers in terms of how they've been treated.
So you mentioned a lack of boundaries, and you talk more about that in your KevinMD article. It's titled "Why Boundaries Should Be Part of Your 2020 Physician Goals." Now, for those who didn't get a chance to read your article, can you just walk my audience through it and share the story of why you decided to write it?
Absolutely. On a personal level, why boundaries matter to me, when I graduated and I was a resident and I graduated, became a staff, that's not something people talked about is boundaries. I mean, everybody talks about boundaries about, the patients and all the stuff that, professional boundaries, but what about boundaries for you as a physician to keep you well? And unfortunately, that did cost me initially at the beginning of my career in terms of financial cost. And I had to learn from my own experiences. And I chose to no longer tolerate when my boundaries were crossed at a particular workplace, when I felt harassed by another physician and nothing was done. And I walked away from that place. And I felt, initially it was very frustrating. Initially, it felt like, I'm walking away from a job, looks like a good job. At the same time, that was the best thing I did because walking away from that job allowed a lot of other opportunities for me to be open and opportunities I would have never experienced if I didn't walk away from the previous job. Opportunities where now I work with a very supportive team that I love working with, that I'm, excited, looking forward to working at emergency department, even though it's busy, and also have my private practice and pursue other opportunities that I have done. That would have never happened if I didn't assert my boundaries about how I should or should not be treated, interpersonally at a workplace and what I will tolerate from another physician or not. And as well as financial boundaries, as a new grad, I didn't know much about money and what billings are, how to make money. And so having financial boundaries also made me realize that I was not remunerated what I was supposed to be getting and what I needed. So having financial boundaries also made me realize how much money I was losing out initially at the start of my career. And many physicians don't know, what the billings, what the amounts compensation should be, because we don't talk much about money and the compensation with our new grads or residents. So that is my personal story, that I walked away from a workplace because I asserted my boundaries. It looked costly at the beginning. It looked like I was losing out. There was nothing that was lost. Everything was at a gain. What I lost was, a toxic workplace. What I gained was a ton of freedom, a ton of choice, learning opportunities, new relationships and networking that I could never imagine, and truly peace and happiness. That's what I gained. So that's my story about boundaries. And as we talk about why boundaries now, we all kind of have these resolutions usually in January. We all have kind of goals. The financial people tell you, what are your goals? What are your tax goals? What do you need to do? Boundaries is one of those goals. It has to be up there with our financial goals because there are financial boundaries that you should have as part of your financial goals. And the pandemic really pushed me to reconsider the priorities and what I said yes to, what I said no to, with 4 children in particular, managing them at home, everything else. The exhaustion and the asks from everybody and questioning what medicine has been for us really pushed me to do more boundary work over the last 2 years and really pushed me to write the book. It's really during the pandemic. The pandemic pushed our boundaries while pulling us in so many directions. The roles we occupy, like a parent, physician, at one point, psychiatrists were being trained to become ICU doctors, like crossing all boundaries of our knowledge. What are we like outside of medicine as a spouse, as a, again, sibling, friend, pet owner? So this article is a reminder of those boundaries, that we need to take back the driver's seat in our life, because the pandemic has really disrupted what our life was for the past 2 years, let alone we forgot what our priorities have been.
So sometimes I think it's very difficult for physicians to set boundaries because inherently by setting up boundaries, that means you're saying no to something or someone. And as physicians, we're always trained to help people, right? We're always trained to do what we can, and sometimes at the expense of ourselves to help people. And sometimes there's a little bit of tension between that ideal of being a physician and setting boundaries. So tell me, how difficult is it for physicians to set boundaries, and what kind of tips can you give to help create their boundaries?
Look, Kevin, everything has a cost. Having a boundary has a cost. Not having a boundary has a cost. Taking a breath, me opening my mouth has a cost. So when we talk about setting boundaries, we have to accept there is going to be a cost. If you don't set a boundary, it's usually our internal cost. If you set a boundary, there might be external cost. We have to be able to prepare, can we afford the cost? What's the cost anticipated? Because, the cost sometimes is lost friendships, lost relationships, workplace, financial. Unfortunately, sometimes when we set a boundary, if I set a boundary sometimes with a patient, it might get violent. So I have to be prepared about that when I'm working. But we have to look at the cost. Look, today I'm talking to you. There is a cost to this. I'm delaying my charting. I'm delaying my patient care, which means I'm going to have to stay later today, which means, when I get home later, I'm going to have to accommodate for that cost. At the same time, I'm choosing to take on this cost of our time together because it's very meaningful for me. I'm choosing to push my time boundary to have this, podcast, and it's very meaningful to me. So when you talk about training and why it's so hard for physicians, we physicians train in a culture that indoctrinates us to function out of fear, obligation, and guilt. Fear of disciplinary problems, complaints, fear of losing a job, fear of being a bad student, bad resident, not hardworking enough. This obligation that is suffocating and beyond reasonable, that we're kind of obligated to fix and rescue things. We didn't cause the badness. We don't cause disease. We didn't cause the problems our patients have. We try our best to fix it. At the same time, we can't fix badness. We could do only what we could do with our training, and realizing that limitation is very hard. And it benefits the system when we put the entire obligation onto the physician, because we're used to that. And then there is the guilt, the guilt, unreasonable guilt. Again, the system puts it on us when we're trained, feel guilty if you say no as a medical student to a case or a learning opportunity, or if you ask to leave earlier, or, question anything. And if there is any patient complication, the guilt that is induced in a physician, that it's somehow their fault, rather than potentially a state of a disease or a predictable complication of a very complicated medical procedure. So physicians struggle with fear, obligation, and guilt, and a lot of shame that happens out of that as well. And we're often isolated in that. So it is very difficult for us to say, hey, I have needs. I need to sleep, I need to go pee, I need to go eat. I'm sorry, I can only handle this many patients, or I deserve, or I need to be paid this much money because, I have my tuition loan, I have to pay my mortgage. We struggle to know our needs. We struggle to know what our wants are. We struggle to know what our abilities are, because those are different for every person, and even our limits. And when we struggle, and medical school and medical training prevents us from knowing those, when we graduate and we start as an attending, we struggle to set our boundaries because we don't know who we are and what our needs are. How can we set boundaries?
We're talking to Maryna Mammoliti. She's a psychiatrist in Canada. She wrote the KevinMD article, Why Boundaries Should Be Part of Your 2020 Physician Goals. Maryna, when you talk to other physicians, either in your coaching practice or your psychiatry practice, and you talk to them about setting boundaries, what kind of response do you normally get for them? And how long does it normally take for your patients to really effectively set those boundaries?
The response most of the time is, I feel guilty. I'm scared about what they're going to say. They're not going to like this. And usually it's the fear of the reaction of the other party involved, right? And usually it's feeling guilty, feeling bad, and feeling afraid, and feeling that they've disappointed somebody or something. And so much preoccupation with the reaction of other people, rather than, wait, I'm actually meeting my need by setting this boundary. So a lot of fear, a lot of guilt. And it takes a while. It takes a long time to be able to be comfortable with setting boundaries and tolerating the consequences, and remembering that other people's responses is a reflection of them. It's not a causation. You saying no is not a causation of somebody's behavior. I teach that to my children quite young. I teach that to my children, that, when they say no, how the other person reacts, that's not a causation. This is why, when my son gets upset, you can't say I hit my brother because, he pissed me off. It's not a causation for you hitting him. When we say no, the other person's reaction is based on their own needs, based on their own life view and worldview. And that's what people forget, and especially physicians, because we're so trained to be responsible for other people's reaction. You caused this, you did this, it's your fault, this person reacted this way. So it's a very long process. It is not something that's overnight. I tell people this: setting boundaries sound very basic. So is brushing teeth. But I'm sure it took your parents a long time to get you to consistently brush your teeth. Now you do it automatically because your parents put in the years of training. Setting boundaries is that. It's basic, yet it's very hard and requires repeated practice. And with more practice, it gets easier, but it is hard.
So what kind of practice do you recommend for physicians who are just starting off trying to set their boundaries? So maybe name some small things that they could do to help get that training.
Kevin, to set boundaries, they need to know who they are. To set your boundary, it's kind of like US and Canada. To set the boundary, the border, you need to know where one country ends and another one begins. So the step one is to get to know who you are. What are your needs? What are your wants? What are your abilities and limitations? That's number one. Before you know that, you can't proceed. Number two, you need to look at what boundaries do you need, because there might be financial boundaries, personal boundaries, boundaries at your workplace, boundaries with your friends, family, time boundaries. What are the areas where you feel the most trapped and resentful in? And that resentment and feeling of trap is almost like a messenger telling you, you need some boundaries there. You need to take some control. Boundaries are like these predictable rules that help us guide the kind of engagement between you and another party. Boundaries gives us that kind of space between two objects. Think about US and Canada. You cross the border, you have a predictable different set of rules about driving or, laws, right? That gives you predictability, the boundary. So think of boundaries as that space or set of rules. And you need to see what areas of your life you feel the most trapped and resentful in to help you guide where you need some boundaries. So those are some quick, easy tips just to start thinking about boundaries.
And my final question, what are some of your take-home messages that you want to leave with the KevinMD audience?
Well, my take-home message number one is take the plunge. I checked your website at 3 a.m. while on call and I got the spot. So see, if I didn't check the website, I wouldn't be here today. So take that plunge, check the website, do what you need to do. Number two, when you say yes to something, you say no to something else. Saying yes to this podcast, I'm saying no to my 15 minutes of lunch. I'll have it later. There's always a cost to having boundaries, but there's a cost to not having a boundary. And my last piece is every physician is a masterpiece, the masterpiece at the museum. Everybody's going to want a picture with you and a piece of you. If everybody took a piece of that masterpiece, we wouldn't have anything left. So that ropes around the masterpiece at the museum is the boundary. You don't have a security guard upholding the rope. You are the one who has to uphold those boundaries every day, all day, because you're going to have multiple visitors coming to you with reasonable demands for them. They'll want a picture of you. They want to post it on social media. They want you. And there's only one of you. So you have to protect the masterpiece or there's nothing left of you. And that's why we feel burnt out. That's why we feel, trapped, and we feel like we have nothing left to give at the end of the day, or we don't know who we are, because that masterpiece is being chipped away with no boundaries. That's my take-home message.